counting the
Cost of being a dentist in Melbourne, Australia.
wow, Berenice, why did you become a dentist?
Yeah, why or when?
Why?
Why? That's a good question. I kind of fell into dentistry. I never intended to become a dentist. I actually thought that I would go into medicine and then become a pediatrician. And to cut a very long story short, when I finished high school, I just kind of put dentistry down as one of the options because I had 12 boxes to fill out and I didn't know what else to put. And on there was like veterinary science and architecture, and there's all sorts of other things that I didn't think I'd ever have to consider. And then in the year that I applied for university, the application process changed quite significantly. And so I found myself with the option of either going into dentistry, which was the second choice that I never thought I'd have to consider, or to move interstate to other states in Australia and become a doctor instead. And so I thought about it a lot, and I started to consider all the good things about dentistry. And I thought, okay, well, let me give this a go. It'll give me some opportunity to have work-life balance, um, to delve into the creative side of science that I like, and most importantly, it will give me an opportunity to kind of go into the mission field and to go abroad. So I went into dentistry instead.
Oh, great. So, you said being a dentist allows you to have a work-life balance, and you can be creative. You can also use it for the mission. So,
Yeah.
I guess you don't need to be practicing dentistry at 3 a.m. in the morning just because patients would call you or show up and say it's emergency, right?
Mm-hmm. Most of the time, yes, that's the case. I mean, if you work in certain practices or if you work in certain clinical settings, that can be a little tricky, but vast majority of dentists will never see a night shift, and if you don't want to, you don't have to work on weekends either.
Wow, that's great. So,
Yeah.
what are the things that you see as using creative capacity?
Yeah, so before I got into dentistry, I never realized how artistic it really is. And so I had always known that dentistry was a health science. There's a lot of physics in it, there's a lot of chemistry in it. Obviously, you're dealing with biology. But there's a certain point in dentistry where you start to work for yourself. And what I mean by that is, you can do a filling, and no one, even the patient, is going to know how pretty your filling looks, how lifelike it is, how close to the tooth shape you've made it. You can just put a blob in there, and so long it works, no one will ever know the difference. But when you take pride in your work and when you try to mimic the natural tooth, it takes a lot of hand-eye coordination. It takes a lot of flair. And when you get into aesthetic dentistry as well, when you think about recreating smiles and so forth, there's a lot of art, color, design, looking at details that people don't necessarily associate with dentistry.
Wow, I see. Wow, that's cool. So, did you always consider yourself as someone that is artistic? That when you began to practice different things as a dentistry student, it just clicked with you?
Um, I always thought I was somewhat artistic. I can't draw super. There are only certain things I can draw very well, but by and large, I never thought that I was a very artistic child. I was never brought up in an environment where art was a big part of my childhood. But I do enjoy design. And so sometimes people ask me, if you weren't a dentist, what would you be? And back in the day, I probably would have said, "Oh, I originally thought I'd be a doctor." But now that I've worked in dentistry now for 8 years, and I think if I wasn't a dentist, one of my hobby professions would be to be an interior designer. I appreciate bringing joy to people's lives by creating design. And so, when I think about how my I guess my creative skills have developed in dentistry, I definitely say that I've gotten better at it. But I was surprised by how many of my colleagues are actually really artistic. And so you may not know this, and next time you visit your dentist, you should always ask them what are their hobbies, because a lot of dentists have very artistic hobbies.
Oh, okay.
A lot of dentists are also photographers on the side. A lot
Oh,
of the guys are, but some of my colleagues from dental school are now like part-time florists. They just do it on the side after
oh,
work. A lot of them are painters and sketchers.
Wow.
Yeah, a lot of them do cake decorating, and some of the older dentists are specialists in like French restoration of furniture and stuff like that. Just very fine motor skill kind of hobbies.
Wow. That's amazing.
Yeah.
Because in my mind, you can categorize each patient's cases or treatments or different conditions, and I thought it would be just very same thing over and over. But I guess every
Uh-huh.
case is different, right?
There are definitely similarities after a while. But when you get into the larger, more complex cases, that's when you really start to see the differences. By and large, doing a simple filling is much the same, and there's a certain series of steps that you follow and procedures and that sort of thing. But the more experience you gain, and I'm still learning this, but as I learn from experienced dentists, the more I realize that the actual clinical procedural part of your job is like 40%. And the other
Oh,
60% is talking to the patient, planning with them,
that's
but also
true.
looking at all the different aspects of their face, their eyes, even
That's true.
the way their chin is shaped, what kind of hair they have, how much lip do they show, and how much teeth do they show when they talk. All these things that go into designing a new smile. And so that
I
actually
see.
takes a lot more work than actually sitting down and doing the filling itself.
Oh, that's true because I noticed many dentists in Korea don't even
Mm-hmm.
look at you, or I can't even see them. I'm like this.
Uh-huh.
I'm talking to them like this, and they're talking to me this way. So I don't feel like I'm
Yeah.
actually talking to them. I feel like I'm just being a part being rolled on a conveyor belt, and they just come and do their thing, and okay, and
Yeah.
next time come this time. So I didn't really see this personal interaction
Mm-hmm.
with a dentist. Is it different over there?
Yeah. Somewhat. I think nowadays dentistry, particularly in cultures that really value Google reviews, which
Oh, I
would
see,
be
I see.
cultures, like Australia, Canada, the US, and so forth. They really value the customer experience. That's one element of it. But it's also the type of cases that you're doing. So if the work that you need to do for the person is fairly routine, like a checkup and clean or one or two basic fillings, that type of discussion is not as involved as someone that really needs quite a lot of complex work. And so that's usually when, the planning process with the patient could be an hour's conversation.
I see. So I guess it really depends. So it requires artistic skill and social skill and all these different things
Uh-huh.
that
Yeah.
as patients we may not realize.
Right, right. Yeah. And it's actually kind of hard as dentists also because um, we are typically type A personalities. And I don't know whether it's because dentistry draws type A personalities or it makes us type A personalities. But the end result is that you leave dental school as a type A. And type A personalities are very detail oriented. We deal in increments of a quarter of a millimeter at a time, and that makes a big difference to us. And so the attention to detail can sometimes mean that we lose the big picture. And so learning how to kind of focus on the patient as a whole is something that I didn't learn in dental school. I think I learned it once I started working, but I've realized how important it is.
I see. So I've been always assuming that wow, looking at people's teeth all day long can be very
Mm-hmm.
stressful because I am not detail oriented, or I'm not really strict with myself in terms of many different things I need to accomplish. I'm very flexible
Mm-hmm.
in many different ways when I do anything. So how do you manage stress? Or is
Yeah,
it
that's a good
stressful? Or
question.
is it stressful to you? How intense is it?
It really depends on the type of dentistry that you end up choosing for yourself. So even within general dentistry, right? There are some dentists just want to be bread and butter dentists that will be very family oriented. See all the people in the family, the kids to the grandmas, and just see them regularly and do very routine kind of things. And then there are other kind of dentists that really just want the challenging stuff. They want the veneers, they want the implants. And so that brings with it a certain type and a certain level of stress. For me, I am not necessarily interested in that type of dentistry. I tend to focus more on family kind of. The area I work in is populated by a lot of young families and young professionals and so forth. That our practice is more on health and prevention rather than on unnecessary aesthetics. Even though we can do aesthetics, that's not our focus. And I think with that ethos, you attract a certain type of clientele that automatically brings your stress level down a little bit.
Oh, I see.
Yeah, which is nice. But nevertheless, the biggest stress for me usually is time. And so I run my day according to the clock. It's just a race between me and time to run on time, because I have so many other things that if I'm running late for one person, my whole day will just get thrown out. And then once you start to run late, you do things quicker and mistakes happen and all that sort of thing. And so time management and staff management are really tricky. And I think stress management for me then in those contexts is to be able to be composed and to recognize that if I do run into a situation where I'm running late, or patient is playing up, or staff are stressing me out in one way or another, I need to be able to act in a different way. And I need to have the resources within my emotional tank to respond in a different way. Because if I act the same way that everyone else in the room is acting, then there's no leadership there.
I see. So you rise above the storm.
Somewhat, I guess. And there's been many a time when some of the most unpredictable things are surgical extractions, and that means extractions that end up being a bit more complicated than you plan, maybe because a tooth breaks, or the wisdom tooth is growing this way when it should be this way, or something like that. And because there are certain things that you can't plan for, like how hard the person's bone is, or how dense the tissues are, or how much you can see and how hard it is to access those things, it can get quite curly quite quickly. And so whenever I'm struggling with this, I can see that as time goes on, time is ticking, so I'm getting stressed. The patient obviously is getting tired. My nurse is getting stressed as well because I'm running late, and my receptionist is walking in and out. I can see them pacing by the door, just checking how long more I'll be. And often I'll find myself whispering to myself and praying in my head and saying, God, I need to be a blessing right now. Help me be a blessing where I can't in my own power. And I've never had a tooth not come out after that prayer.
Wow.
Yeah.
So it did help when you...
Yeah, it definitely helped. Yes, for sure.
Wow.
I'm quite little. I'm not built for extractions, but definitely the sense of the divine really gets you through that.
Wow, that's amazing. I remember one dentist who I consider the best dentist because of the kind of interaction that he had with me. And I don't think it's very typical for patient and a dentist can have that kind of dynamic. So he was my church elder, and he was talking to me the whole time. And he talked a lot, and he didn't talk about just anything. He talked about things that really made me laugh. I don't think if it was intentional or what. Actually, he has been a pastor before, and he would come to the area where people would normally sit and wait. And he would like kneel and talk to people as if he's passing a church or something. So the interaction he was having with the patients and with me just really shocked me. And actually I felt less pain because he was, and I was like, my mouth was open. I was like, because it was so funny. He kept asking me questions. I'm just like, and he kept talking to me as if my mouth wasn't just forced open,
Yeah, yeah,
and
yeah.
just how enjoyable that experience was.
Yeah,
He went to
yeah.
Canada, so he's not here anymore. But it's just one of the
Okay.
unforgettable experience.
That's amazing.
It was pretty amazing. It was literally less pain. It was very enjoyable because for me, that sound is just killing me. I don't know
Mm-hmm.
how many times I pray when when I'm just lying down there. It's because it's so painful. Even scaling is
Mm-hmm.
very painful.
Mm-hmm.
So how do you uh, how is your experience as a patient when you lie there, if you have been there, or how do you who do you look up to as a dentist? I guess my questions are twofold. What is the most
Right.
ideal experience you've ever had as a patient and as a dentist? When you look at yourself
Mm-hmm.
or look at anybody as a coworker, or if you have anybody you look up to.
Yeah. So, I I'm not a very good dental patient because my mouth is so small
Oh, I see.
that whenever dentists work on my mouth, like for example, when my boss is doing my cleaning or whatever, he has very big hands, right? He's 6'4", he's very tall, and so he's like, "Oh, your mouth is so small," like I find it so hard to, so hard to work. I have that discomfort, I guess, being a patient as well, trying to stretch open, trying to stay
Ah, I see.
um, wide open when things need to happen. Um, so I understand that side of things, but I think what you're saying, I can relate to because one of the bosses that I really look up to is the one of the dentists, sorry, that I really look up to is my boss, and he has a similar kind of personality and persona that you're
Uh,
describing. It's one where you can tell that the dentist is working for something larger than just the teeth.
wow.
Like there is a person behind those tools. They have a personality. They have things that they're interested in. They have work-life balance. They're here, yes, because they want to help you, but this is not their entire world. And when you bring that kind of approach to your work, you don't take yourself too seriously, and patients just feel like there's a bit more connection because you're a person like they're a person too.
Exactly.
You're
Yeah.
not this like, and in Australia, that's the other thing. In Australia, we don't wear white lab coats as doctors or dentists,
Oh.
and so my boss literally walks up to work in a t-shirt and jeans, and at first I thought that was so strange. I was like, oh, I've never been in a clinic that allows us to dress like this. Usually, it's like at least a shirt and whatever. Then he changes into his scrub tops and so forth. But he definitely uh, the way that he's built the practice and the way that he carries himself in the practice really makes it seem like people are coming in to catch up with their friend that they haven't seen for 6 months.
Wow.
And so the minute that they walk into our waiting room, there are in a non-COVID situation, there are refreshments. There's
Oh.
apples and oranges for the kids and a fruit bowl for them to eat. Like which dentist
Wow.
gives you food to eat
No,
before they see
no,
you, right?
nobody.
Yeah, there's and then they come in and Michael remembers everything about everyone's life and how many grandkids they have and what their dog's name is and
Wow.
all that sort of stuff. And so more often than not, you'll just see patients flood our clinic with payment in food. Um,
Wow.
Greek cakes, Greek desserts, Greek chocolates. I mean, very bad for your teeth, but potatoes from their garden, lemons from their tree,
Oh.
olives that they've pickled, all these types of things because they really just see you as family.
Wow.
And so I think, even though I'm not Greek, a lot of the patients are old Greek ladies, and I don't kind of have that same rapport that Michael has with them. Um, but when we kind of, you can tell when you walk into someone's practice and you know that this feels comfortable because it doesn't feel like they're trying to swindle you out of money. They're not
Uh-huh.
here for the money. They're working for something
Yeah.
bigger than dentistry. It
Mm.
makes a difference.
Wow, that's really beautiful. I think when we have that genuine connection with people, whatever you do
Mm-hmm.
is just takes it at a different level.
Yeah.
So,
Yeah, for sure.
do you have any patient that you remember that just
Oh.
makes you keep smiling, or have you ever had a really good experience with any patient that you just keep thinking about? Or
Yeah, there's a few. There's quite a few. I think the ones that stand out to me are the ones that we've taken from a point of coming into the practice and they're really anxious. They've had dental trauma in their life. Maybe ever since they've been a kid, they've been very anxious about dentists, phobic of dentists. But then they have like a gazillion things that need to be done in their mouth, and they just see it as this insurmountable mountain. And we see them, and 2 years, 3 years later, they're finally at the end of it. And it's just so rewarding to hear them say at the last appointment, like, oh, that's it? I don't need to come in anymore? And I mean, of course, we get them in for their checkups and so forth, but to see them kind of end that journey, not necessarily only with healthier teeth and hopefully no pain and a smile that they're more confident with, but just a lot more self confidence and like they've conquered something really hard in their life.
yeah,
Yeah, that's really rewarding.
wow, that's great. So when you see that, you're both happy it's over. Finally, it's
In some
over.
ways, yes. In some ways, we're happy that that kind of intense work for them will hopefully never have to happen again.
That's awesome.
Yeah.
So, you talked about how you consider being a pediatrician,
Hmm.
being a doctor for children.
Yeah.
So, did you get pressured as an agent, Australia, that you have to be a doctor or anything?
Um, yeah, I mean, there was definitely unspoken pressure. A lot of my extended family are doctors, so a lot of cousins are doctors, some uncles are doctors. And so when I was kind of tossing up dentistry versus medicine, there were definitely family members that were like, you're going to find dentistry too boring. It's not going to be stimulating enough. It's not going to be intellectually challenging enough for you. So you should go into medicine. So definitely there was that unexpected kind of, what is this dentistry thing? But also because it was so unknown, right? Like I don't have any dentists in my family or
Oh,
extended
I
family,
see. I see.
and so they didn't know anything about it or what it was like or anything like that. But I think one thing that I appreciate is that my parents kind of sat me down and they kind of said, knowing your personality, you're someone that thrives on new challenges, not necessarily the same challenges all the time. And you would do equally well in both. You could be as useful to humanity in both scenarios. And so knowing that made it, it didn't make it an easy choice, but it definitely helped me realize that it's not dentistry versus medicine. It's what's available to me to be useful to other people. And at the time, dentistry was the most available option to me, and I'm grateful for that now. You know, I was kind of worried that, like you mentioned, I thought it would be really mundane. I thought I would just get bored of drilling and filling all the time, which no doubt every dentist does. You know, all dentists look forward to a point when they can scale back on the mundane stuff and do the more exciting stuff or find other ways to make money and just go out of dentistry altogether, out of clinical dentistry at least. But I found that dentistry, the most exciting thing about dentistry is the flexibility it offers because you can dictate your own schedule, you can choose what kind of work you do. And with that free time and financial flexibility that you then have, you can do other things that you enjoy. So, for example, one thing that I found I want to do in the future is global development and specifically, hopefully, oral health and global aid in that domain. And so I've taken time to do an MPH on the side, studying part time. And because of my work arrangement, I'm able to go on lots of mission trips and I'm able to see how that can make a difference, which I think you can get to that point in medicine, but it takes you a long time
Yeah,
because
right.
you've got to go through the 10 to 12 years of training first.
Oh, I see.
Mm.
Because I've noticed that, as you said, medical doctors tend to see dentistry as something not as intense, not as challenging, not as whatever.
Hmm.
But you can definitely manage your time better, and you can do other stuff also. So
Yeah.
so because I was talking to this medical doctor, and he said when I take a vacation, the entire hospital gets angry because the whole thing needs to stop if I'm
Right,
not
right.
there. So
Yeah.
he feels pressure to keep going, even on Christmas, even on
Hmm.
Thanksgiving, New Year.
Hmm.
So I guess you're not as free as a dentist
Hmm.
can be. So I think. Um, but do you think it is fair to say it requires more training is a lot harder to study as a medical student because you know so many medical doctors.
um, well, I can only speak for the experience in Australia. I think the US training system is quite different. But in Australia, medicine versus dentistry, I mean, my brother is a doctor, right? So
Yeah.
comparing the amount that we studied, I'd say that I studied as much as he did.
Okay.
I might be biased, but I feel like we both put in
I see.
more work. Um, but but we are different kind of learners.
Mm.
So my brother is not a detailed person.
Mm.
He doesn't learn that way. He learns conceptually. He learns
Oh,
big
I
picture.
see. Mm.
And then obviously in medicine you then go into a specialty area
Mm.
and then you try to master the amount of data and information in that specialty area
Ah, I see.
instead of trying to master the data in every single area of the body, which is just impossible in 5 years of study.
I see.
Whereas in dentistry, true to its type A kind of persona, it is very much master everything in the head and neck in 5 years.
Mm.
And so the way that the course is set out, the rigor of the course is similar, but it's much more honed in into everything here instead of just a bit of this and that and the other.
I see.
Yeah.
Wow. So when you were growing up, did you have many different kinds of dreams other than going into this health related things? How was your childhood like?
Yeah, well, I grew up in Singapore until I was age 6, and then I moved to Melbourne. And I really didn't know what I wanted to be. I I enjoyed kind of teaching, I guess, as close to teaching as I thought it was, like, just playing with kids and drawing pictures on a whiteboard and all that sort of stuff. But I didn't have any kind of set goals that I wanted to hit or professions that I was heading towards. And I really enjoyed food, ironically. Weird for a dentist to say, maybe, but I did my work experience. We have something called work experience here in Australia, which is where in ninth grade you choose a vocation that you think you might be interested in, and you spend 1 week of your school year as a student volunteer.
Wow.
So it could be like if you want to be a florist, you go find a florist that you can shadow for a week. If you want to be a chiropractor, you go and find that. And so I actually did my work experience as a nutritionist, or with a
Oh.
nutritionist, I should say,
Oh.
in a hospital because I thought, oh, like I really enjoy food. I enjoy the joy that it brings to people when I make food. So maybe I can look at how I can impact people's relationship with food through nutrition and dietetics.
Mm.
And so I was in a big hospital for a week, and so I think I really kind of dabbled in a couple of different things, and that to me is why dentistry suits me because I do like to dabble in this and that and the other. I'm not someone that has always, from age 6, known that I wanted to be a doctor and has that singular interest in life, and I have the flexibility now to be able to do all of those things.
Wow. That's that's very interesting. So ninth grade. How old were you
Mhm.
at the time?
So a ninth grader here is 15 years old.
That's
Yeah,
that's
I know. Like,
amazing.
how do you know what you want to be at 15? I'm also not sure, but
Wow.
at least I get to try something.
So as a 15-year-old, um, do you guys do? I think Singapore is like that too. Do you guys like study until like 10 p.m. after school? You keep studying, and do you guys do that in Australia, Melbourne?
No, no, definitely not. Yeah. I mean, school finishes at 3 p.m. and then after that it's sports, like all the kids are doing extracurricular sports and stuff. I mean, there are tutoring schools, but vast majority of kids would not attend those.
Okay, uh, so if you were to be a dentist in this country,
Hmm.
you would be pressured by your mom and dad that you need to study all day long until you go to bed, even after you
Well,
come back to school. But it was still possible for you to get into dental school and you're a dentist now. So how was your life like as a student, even though you didn't work as much hard as people that are doing here?
yeah. Okay, so I guess I should clarify. Like, I guess homework at home, I counts as study, but I wasn't in like tutoring classes until 10 p.m. But definitely there was homework to be done and so forth. I had an interesting childhood because for some part of it, from when I was 11 years old, my dad had to work overseas for a while and he wasn't able to be back in Melbourne frequently. And so for the large part, my mom was working full time and raising my brother and I. My brother was 14 and I was 11, and also running a church plant that she was
Wow.
involved in, right? And so when you are thrown into that situation, you grow up really quickly. And
Wow.
we were kind of taught by necessity to look after ourselves. So a lot of the time, mom would like write down on a piece of paper, please make this, this, and this for dinner, and I'd
Wow.
make dinner. And
Wow.
she would do amazing things like drop me off at school. She'd go to work. I'd come back from school myself. We would be responsible for our own homework and music lesson practice and whatever. She'd come back from work. She might take us to a music lesson, feed us dinner, and then she'd drive out to give Bible studies to someone, and we had to finish our homework and get ourselves to bed. And then
Wow.
during the weekends, we were all playing a role in running a church. I was in charge of what we called the service team, which was like feeding people for
Wow.
Sabbath lunch. And my mom would be like preparing Sabbath school and blah blah
Wow.
blah and all that stuff. So I guess when you learn that you've just got to do some things and no one's going to pick up after you, you just learn to fit it in. And I think ironically, having lots of stuff in the schedule brought balance to our life. It gave us perspective for, hey, we've only got a limited time to do our homework, but we're going to do it really well while we're here. Um, and so, really, my childhood, well, my schooling years that I remember was centered around going to school, music, and church.
Oh,
And yeah, there wasn't really much time for anything else.
wow, that's so beautiful because I wanted to make some money to have more
Uh-huh.
money in my pocket, so I began to
Uh-huh.
uh pass out these flyers for the chicken
Okay.
shop. And my
Yeah.
mom got super upset and said, "All you
Mm.
need to do is to study, 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 study,
Mhm.
study, so you can get A's and get a good job. Drop that
Mm.
thing." And I was never
Mhm.
allowed to do anything else other than studying, studying, studying. But when I listened to you, you're able to do all kinds of things that made you become responsible, independent, capable, all these things. And it sounds
Yeah, I
very
pray so.
beautiful.
I pray so. I mean, it definitely didn't feel easy going through it. I
Yeah.
think it looks like a nice picture looking back, but um, yeah, I think when I look back at it, it didn't feel like study was a chore. It just felt like, this is something we know we have to do. Like we have to eat, we have to study, we have to we have to contribute to church. It's just, it wasn't something that we resented. It was just non-negotiable in our lives. And I think that was like a healthy relationship to have with
Wow.
our school.
It sounds like an amazing boot camp organized by your mom. It worked just right. Being able to cook, being able to serve people, organize the program, run the program, serve people, get good
But I missed
GPAs.
out on those chicken flyers, like I missed out on so many happy childhood memories I could have been making.
Oh yeah. Wow. You and I lived a very different kind of life. So when I went to the army here in Korea, I didn't know how to
Mhm.
do anything.
Mm,
So
mm.
I was just told that you don't even know how to like wash the cloth to wipe the tables, and I was like doing this. I'm just like, that's not how you wash it, and it was just very humiliating because I didn't learn the things I should have learned at home, and all I knew how to do was just to play games and study.
Right, right.
So wow, I just admire your whole family dynamic. I have a last question for you.
Yeah.
So what's happiness or success uh for you? Because for me,
Mm,
my father passed away from cancer when I was in high school, and he
mm,
was busy working for the government, and he hardly had time for the family, and he
mhm,
passed away. That cut the
mhm,
time pretty short. So
mhm,
I decided to invest a lot in family. So I'm
mhm,
working at home. So
mhm,
it's amazing. This is a life I've always
mm,
wanted. So for you,
mm.
what is your perfect life?
My perfect life. Yeah. I enjoy working, but I don't want it to be my life, my entire life. And I think as much as dentists have flexibility, one of the biggest temptations in the dental world is that you control how much money you can make.
Wow.
Whereas when you work in a hospital as a doctor or whatever, you're
Mm.
somewhat capped. I mean, there are ways, but
Oh, I
you're
see.
somewhat capped by like how many hours you can work in the operating room. It's just not free for you right now, like
Ah.
you have some limits. But as a business owner, when it's completely free terrain, you can buy 10 dental practices if you want. You can make
Ah.
it a mega clinic. Or you can just be a humble one clinic kind of business operator and go from
Mm.
there.
I
And
see.
so there is a real temptation in dentistry to be driven by greed. And a lot
Ah.
of the profession is that way
Mm.
orientated. I don't own a practice myself, and that's a choice that I've kind of made at this point in my career, at least. Um, but I think I enjoy work because it brings me intellectual challenge. It makes me happy to know that I've made someone's life better each day. They may not agree with me when they're sitting in the chair, but I know that I've made someone's life even a little bit better that day. And that kind of immediate satisfaction I get is not something that I think doctors may be able to experience every day.
That's true.
And it's the same in the mission field. You always see there's one line to see the dentist and one line to see the doctors.
Mm.
And when you speak to a lot of mission dentists, what they appreciate is that they know immediately that the patient that has left their chair has left with less pain than when they sat down,
Mm.
right? Or at least as a consequence of what has happened,
That's
they will
true.
have less ongoing pain.
That's true. That's true.
Yeah, and the doctors are not always able to
That's
provide that
true. That's
instant
true.
relief.
That's true.
So I enjoy that, but I also enjoy being able to spend time with family, um, and also being able to appreciate beauty in the world around us. And so that might mean spending time in nature, but also bringing joy to people's lives in other way. Like I talked about design, I talked about food, um, about that personal connection. And so ideally, um, work-life balance for me would be probably working like 3.5 days, and then getting involved in volunteering maybe for a day or so, and then spending time with family and with friends and loved ones.
So
And
you
in there,
typically
mhm.
work 4 days a week.
Right now I'm working 4 days, and I'm doing an MPH for one day.
And you also study. That's true.
Yeah, yeah,
Oh,
yeah,
that's pretty cool concept. That
yeah.
amassing wealth is not always the best thing that can happen to you.
No, there is. If you want to make money, dentistry is not the easiest way to do it. There are a lot of easier, quicker ways to make money, and so you've really got to go into dentistry because you love it to a certain extent.
Mm,
Um, and when you do, you will know how to draw those boundaries,
mm,
and you will know how to work in a way that doesn't make you burn out and doesn't make you disillusioned with all the bad bits that go with the fun and the joy of it.
wow, that's awesome. Hey, I'm sorry that I said it's the last questions, but when you're talking, I have a few more questions. Is it okay?
Okay. All right.
So, um, you said you're not owning a clinic yet,
Mhm.
and how do dentists typically work their way up? So they get employed first, and they're getting their
Mhm.
experience, and they own their thing, and they branch out. Is that is that how it works?
Yeah, so in Australia, you usually will work for someone else for maybe 3 to 5 years. And at usually the 5 to 8 year mark, people start thinking about either buying an older practice from someone or buying into the practice that they work in currently and becoming a partner of that practice. And so when you buy over a practice, then obviously you inherit all those patients. And you can't just turn up day one and say, "Hey, I'm the new owner," and take over completely because no one will follow you. And so usually you have to kind of start building a presence there, and that might mean you start working 1 to 2 days there a week and keep your old job for 3 days, say, and then you start to reduce on this side and increase on this side. Um, Other people at the 5 to 8 year mark will start and just say, "Nope, I want to build my practice from scratch by myself."
Ah,
And so then they'll acquire a premise and they'll fit out the practice, which is quite a costly endeavor, and then do the same thing again. A lot of people will still continue to work elsewhere because they'll have no income otherwise, and then do
oh,
1 day a week, 2 days a week, and then slowly
oh,
build up and then reduce their days elsewhere.
oh, I see.
Yeah.
So, I mean, you told me about your plan to do some kind of developmental work or something abroad or mission work or
Hmm.
something. So,
Hmm.
what is your broad picture?
Yeah, so I'm doing an MPH because I have an interest in global oral health, and so that's quite different from owning a private practice, right? There's a lot of people when I tell them that I'm doing an MPH, they're like, "So what does that do for you right now?" I'm like, I don't get a pay rise.
Yeah, yeah.
It doesn't mean much for how I treat you.
Uh-huh.
The feelings are going to be the same,
Uh-huh.
but it just means that I have a bit of a broader perspective that dentistry doesn't just end here and
Uh-huh.
now, that there's a bigger picture to the way that people live, the environment, the food that they have available to them, social determinants of health, and how that impacts who and when they come into the dental clinic, right? And if there's even a clinic for them to come into. So,
Mm.
all those types of things. And so, because I have that interest, um, I imagined, and this is my hope, that in the future I would be able to spend maybe like 8 months of the year, say, in a home base, wherever that might be. And right now that's Australia. And about 4 months
Ah.
of the year in an outpost clinic somewhere.
Oh, I see.
Yeah, and make that kind of like a permanent place of
Ah.
mission rather than just going there once, doing stuff, and then
Ah.
figuring out. Mm.
So the clinics typically would allow that kind of dentist that would work just for 8 months of the year.
Nope. So it wouldn't be like 8 months. Okay, see you later. I'll see you in 4 months' time. I think that's quite untenable. But you could do like, say, you could work for 3 months and be absent for 3 weeks, and then work for 3 months and then be absent for three
Ah,
weeks.
I
And
see.
you've got to space it out,
Ah, I
which
see.
would probably work better for the other side as well. Anyway.
Ah, I see.
Um, yeah.
Ah, so it's not just 8 months work, 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 and then 4 months
Correct. Yeah.
break. Oh, I see.
Yeah.
And
Hmm.
then another question that I had is that I noticed when I go to the medical clinic, their purpose is not always me getting better. They're
Mm-hmm.
typically what I sensed is, for example, when I went there because my eyes were dry, they didn't say, "How many
Mm-hmm.
hours are you spending watching the screen?" They didn't ask. They just said, "Okay, these are the eye drops I'm gonna prescribe. Come back so I can give you another one."
Mm-hmm.
I didn't feel like
Mm-hmm.
they were trying to work with me to help me change my
Mm-hmm.
lifestyles. And I that's the
Mm-hmm.
moment when I decided, okay, I'm gonna change my habit. I'm not coming back, which is what happened.
Right.
So, and I know some people say, oh yeah, this dentist didn't have to do this, but they did it just so that
Mm.
they can maximize their profit. So, as a
Mm.
dentist that practice dentistry, how big is a temptation as a dentist to suggest something that they don't need to maximize your side of the business, even though they can perceive that as their advantage they're
Mm.
getting. So how do you deal with the temptation, or how does that work, the dynamic?
Yeah. Yeah. So I think there's a few different temptations in dentistry, right? The first is what you're saying, where there's a temptation to overservice the patient. So to offer them things that may not be absolutely necessary, but obviously bring a bigger profit margin. And the way that I've overcome that temptation, number one, is to choose where I work.
Mm,
And you choose the ethos that you're going to practice
mm,
by when you choose a clinic that you're going to work with. So that
mm,
and the second thing I'd say to that is that I've trained myself to be less tempted by that, by the way that I deal with the second temptation. And the second temptation I'm talking about is particularly when you have insurance patients. The way that insurance works here is that there are some patients where you know that the insurance will cover most, if not all, of their bill. And so, especially with those patients, there's a temptation to put in like every single thing you can because they won't even know the difference anyway. They're not paying anything, right?
mm. Oh, I see.
But the insurance will pay you,
Oh, I
and
see.
the patient will not even know.
Oh.
And so a lot of corporate type of clinics will do that, where they'll for you go in for a checkup and clean, and my practice literally only charges a checkup code and a clean code. But some practices will do checkup, clean, fluoride, pictures. I talk to you about how you brush and this and the photos and models of your teeth and whatever else, and it ends up being like a $600 bill, but you never see it because the insurance pays for it.
Ah, I see.
And so, and there are the same kind of concepts with certain government patients where the government pays for it and all those sorts
Mm,
of things. And when you're a new dentist particularly, it's so exciting to actually be able to bill for money for
mm.
anything, right? Because
Yeah,
you're
yeah.
in dental school and you've been like doing all this stuff for free as a student dentist. And the first time you actually get to press a code, even if it's for $10, you're like, wow, I just earned money. And that temptation to charge codes that are not absolutely necessary, or to sometimes use a code that is common but not exactly what you did,
Mm,
is a very small one that no one will ever know except you and the Holy
mm,
Spirit.
mm,
But every time I guess I've been tempted to do that, I've told myself, no, it counts. It counts what I choose to do now because that builds my
mm.
integrity for later.
Wow.
And so I think I've had to tell myself, and I guess I'm ashamed to tell you this, but I've had to tell myself
I
quite
think
a few
I think
times.
all
But
do, all do. Yeah.
it builds a habit,
Yeah,
and it
yeah.
builds a habit to the extent that when you're faced with bigger things like, hey, should I push a crown or not? Um, which is substantially more than just changing to get 10 extra dollars.
Uh-huh.
Um, it doesn't become a choice anymore. It's just like you don't
Mm,
even think about it.
wow. So, because you chose that kind of clinic that would allow you to be honest, you
Hmm.
don't need to be conflicted when your clinic would pressure you otherwise, right?
Correct.
Wow.
Yeah, correct. And I've worked in a lot of clinics. I used to work part time in this clinic only, and I used to work in other clinics. I used to do a lot of casual work. I've worked in Canada as well. I lived there for a few years, and so I've seen a lot of different things out
Mm,
there. But ultimately, I came back to this practice because
Mm,
I knew that no matter, even if the patient walks out the door and I haven't earned the practice anything,
mm,
if there was a justifiable reason for that, it would be completely fine.
mm,
And so the expectation is that you would just do what you need to do.
mm. Oh, that's beautiful. Because I was
Yeah.
also tempted not to pay any tax because that's what most people that
Mhm.
teach at home do. They say
Right,
that
right.
I make just this much and I pay no tax.
Yeah.
So I was thinking, okay, if I pay this much tax, I will be able to pay more next year if I make more. But if I don't pay now, I may
Mhm.
just be considered as unemployed my whole life.
Right,
And I don't want that kind
right.
of life.
Yeah.
So I've been paying tax very honestly, and it's a lot of money. but
Yeah, it is. It
but you
is.
gotta do what you gotta do.
That's right.
So
And I think, it's kind of, I guess it's the same as tithe, like
yeah,
if you build that habit when you're young and
hmm,
when you're starting out,
yeah.
um, when you're dealing with bigger sums of money, it's not really something you have to question anymore.
Wow. Thank you so much for answering all my questions. I have only
Of
just one
course.
left. Really,
Okay.
really true. And because I was just drawn to the all the questions that you were answering because it was very interesting because I've been
Hmm.
just lying down there. I've never asked this many questions to a dentist, so it's just been very fascinating so far.
Yeah.
So the last question, uh, when I eat fruit, I rinse
Hmm.
my mouth
Hmm.
with water,
Hmm.
or it will be very like I feel like something acid is going on. So,
Hmm.
what is your recommendation for the people that want to treat their teeth on their own?
Yeah. Okay. So you're talking about the effects of acidic erosion.
Yeah, yeah, yeah.
And some people, if they already have some acid wear or dental wear, then the second layer of the tooth, not the white part that you see, but the slightly yellower part underneath, that's called dentine, becomes more exposed than it was before because you've worn away the white. And so things like cold, sweet, hot, acid will make you feel like
Mm,
something's there. Unfortunately, the ironic thing about exposing eroded dentine to more acid is that it'll wear away,
mm,
right? So when you eat particularly citrus fruits, or
mm,
people sometimes like to suck on lemons and stuff in the
mm.
morning because they're like,
Yeah,
oh, it's good for my body or whatever.
yeah.
Then all that acid just like sits right on that dentine layer.
Uh,
And if it's allowed to sit there, then it will just erode your teeth away even more.
uh,
So trying to remove the acid from the surface of the tooth is a good idea.
mhm,
However, if you wash it away with water, then what you've done essentially is the acid has sat on the surface of your tooth and uh, eroded the minerals in the structure of your tooth.
mhm,
And then you just let the water wash away those minerals and you'll never get them back.
mm,
But if we're able to do something where it helps those minerals that are kind of like simmering on the surface,
uh,
eroded because of the acid wear, go back into solid form in the surface of the tooth, then that's ideal.
uh,
Right. And so that's usually done. Some people will recommend, it doesn't taste very nice, but a bicarb soda rinse. So that means bicarbonate soda, and you put a little bit in some warm water and you just use it as a rinse because bicarbonate soda obviously is basic and it has ions that will help to add into the surface of the tooth.
uh,
Honestly, it doesn't taste very nice. So
uh.
the other the other way people do it is to have some type of chewy food after having fruit that will stimulate saliva flow and not brushing or rinsing straight away. So obviously brush your teeth after you've had something sweet like fruit, but maybe like half an hour later, right?
Uh-huh.
And so I'd say sometimes to people, have some nuts after
Uh,
you've had fruit because the nuts produce saliva you have to chew, and the
uh,
saliva has ions in it that will help to remineralize or add mineral back into the surface of the tooth.
so instead of just rinsing it with water, I can use that special thing and or just eat
Yeah.
nuts.
Or something that will stimulate saliva flow.
Saliva
Yeah.
flow.
And then brush your teeth with some delay that there's not that effect.
Mm. Wow, thank you very much,
Yeah, of course.
Berenice. Do you think I can do this a few years later?
I'd love to. Let's chat again. We'll see where we're at.
Yeah, yes, it was very interesting and very fascinating. And I didn't get this kind of spiritual, very solid, very honest uh, view on their experience on dental
Mm,
practice. So it was very helpful for me to become a better human being and getting this beautiful story out there
I'm glad. I'm
through
glad.
this channel.
Yeah, for sure.
I hope you have a good night and stay healthy and until
Same
I
to
can
you.
talk to you again.
Hopefully, yeah, hopefully we'll be able to meet sooner rather than later,
Yeah,
COVID allowing,
sure.
and we'll be able to swap more stories then.
Yeah, I've never been to Australia anyway.
Yes, yes, you and your wife will have to come visit.
Yeah, you can also. Well,
Will
you're
do.
welcome to visit here.
Will do. All
Bye,
right, take
Berenice.
care.
Thank
Bye-bye.
you. Bye bye.
See you.
Uh huh.